And gentlemen, welcome to lesson 1 for Roblox roleplay techniques. My name is Ethan, or Dr. Ken Guido Sarah MDLTP, Maple Hospital. I'm primarily on the Capital Memorial server or the Marigold Memorial servers, and I usually perform as a head surgeon there. In charge of doing trauma surgery. Today we're going to be talking about chest tube insertion. This is lesson 1. I'm going to go ahead and head to pre-up here. Why a chest tube? What is a chest tube? The introduction. Chest tubes are essential for addressing abnormal accumulations of air, blood, or fluid in the pleural space. So this is a normal, healthy lung right here. You can see it's filling up. So we zoom in, we can see that lung is filling up and expanding to air, right? Just visualize that expanding to its full space. This is the punctured lung. This is the pleural cavity around your lung that carries the lung when it's expanding. When fluid or air reaches inside of its pleural cavity, we need to relieve it with a suction system like this, called the chest tube. And the chest tube is going to allow for the patient to breathe. It drains air, blood, or fluid, like this fluid right here, to expand the lung. Resolves pneumothorax, hemothorax, and pleural effusion. These are the differentials that you would use during a chest tube. And lastly, it prevents respiratory stress, distress, and shock. Now, moving on to pre-op. Be sterile, be safe always, okay? We always wear proper PPE, especially in Marigold Memorial or Capital Memorial. Take a look at figure 1 right here for an example of PPE. This is figure 1. This is my character, Ken Sarah. So PPE here, he has scrubs underneath this gown, but he also has a surgical gown tied on top with mask, gloves, visor, and his glasses, of course, all hair tied backward cap. So very minimal skin showing here, making sure he's as sterile as possible. If you're in an emergency setting, it's all right. Just wear your scrubs, but make sure to have a mask and gloves on. Now, next up, make sure you have the right team for the job. We don't need an anesthesiologist for this, or not too many fancy people. 1 or 2 people, maybe 3, isn't good enough. So the trauma surgeon or ER doc always will perform the actual chest tube. The nurse will assist with sterile setup and supplies, or if you're in an emergency, you can do it yourself. You don't have to have a nurse there. And then the respiratory therapist is not even needed. Like, it's just there to monitor breathing. You can monitor breathing, the nurse monitors breathing. You guys went to quote-unquote medical school, you know this. Operation does not need to be done in an OR. It can be used for emergency cases. ER doctors can do this too. It's a very important emergency procedure. Now the procedure itself, we're going to start with preparing our patient. So this is the position that you would put a patient at, as this bed here, a 45-degree angle. Now you would lay out your tools, or you have a nurse lay out your tools, and then a nurse prepare a sterile dressing and drape. So these actions I put here are for your role play. You can feel free to copy and paste from the PDF down below. Pre-incision. You now mark the 5th intercostal space at the mid-axillary line with a surgical marker. This is where the 5th intercostal space is. It's usually 5 or 6 ribs down where you mark it. It's on the side of the patient, on the side where there's the lung. So I'm talking like on the side of the armpit of the patient, so the side of them and not the top of the chest or any area. Now, if you have more experience for your character, you don't need to mark it with a surgical marker. I always suggest it. Now, you clean the skin with antiseptic solution, such as this dressing right here. And then inject local anesthesia, lidocaine or something like that, around the marked side, and you wait 2 or 3 minutes for the RSNM. Now this is the incision and primary procedure. You would take your scalpel, make a horizontal incision through the rib, near the 5th or 6th intercostal space. Now be sure, guys, to avoid nerve endings or stuff like that. Sometimes roleplay patients are very experienced. They can say that you've reached a complication if you don't really square in on your incision line. A Kelly clamp is pretty much a pair of scissors, as shown on screen here, to perform blunt dissection through the tissue. Now you would then use that and then insert the chest tube, 36 French. I usually use 32 French because it's more easily put in through the masses, but you can use whatever number from 28 to 36. Now, connect the chest tube to a suction device. So if I go back to the slides here, like a suction device like this to get the air and the stuff out. And then suture the tube securely in place, as you can see right here on the screen. And then apply a sterile dressing around the insertion site. Have a nurse and yourself confirm that both sides of the chest are rising. that's pretty much it, guys. That's how you put a chest tube into a patient on Roblox and technically in real life as well. All the procedures are the same. I do not suggest you do this if you're not a professional, medical professional at home. This is for roleplay only. Capital Memorial Medical Center. Next up, lesson 3, we're going to be going over surgical emergency exploratory laparotomy, which has to do with, it says a laparotomy with a P, which pretty much has to do with looking for internal bleeding, a burst appendix, or something happening internally that imaging cannot see. This will be lesson 3, and thank you for so much, guys, for tuning in. Capital Memorial. Have a good day.